Hello, everyone, and welcome back to Ode To Birth podcast. Today, we have Daniel Williams back with us to share more information in regards to German New Medicine. This theory and this way of understanding the human body and this ease within the body is really taking the world by storm, I will say. It's really present in the field right now. And so we're so happy to have you, Daniel, here with us today. Last time we got into female reproductive organs, and we're going to continue that today and go into an extended version of that. And I'm really excited to hear what you have to say and learn even more around different conflicts that certain women that might be dealing with. This can be a really important and powerful episode for some women that are dealing with reproductive organs challenges, issues. So yeah, before we get going into the content, Daniel, do you want to share a little bit about just a tiny snippet again on German New Medicine and why we're even here and why this even matters today?
Yes, perfect. Thanks a lot, Madison. Thanks for having me again. Do you want me to share the screen just to help us visualize?
Yeah, so for those who are
Yeah,
listening to this podcast
yeah.
through audio, you should be able to understand everything. But if not, then please refer to the video because Daniel's sharing his screen and it helps kind of break down the theory a little bit better.
Yeah, okay, thank you. So a brief intro again, and basically, completely, German New Medicine is the science of the psyche, brain, body. And to me, when I've been studying it the last few years now, and once I learned it, after always looking for the keys to health really and how to figure out why we experience all these symptoms, this came to me, and it was just, yeah, just a paradigm shift and everything made sense right away. For me, it just was very intuitive and I learned it quite quickly. Yeah, because it just had so many answers that I feel like I'd been looking for, and probably many of us have been. So Dr. Hamar developed it. He was a really well-respected doctor in Germany, and he was about 40 years old. He had patents on medical equipment, and then when he was 40 years old in 1978, his son got shot, his son Dirk, and it was a bit of a tragic situation, and I won't get deep into that right now. But soon after the death, he got testicular cancer, and he, had to postulate that there has to be a correlation. I've never really had any cancer or anything like this. I'm a healthy man. My son dies, and it was just a very challenging situation for him. And he got testicular cancer. So he got his testicle removed, which he wouldn't have done later after having discovered what he discovered. But he became the head internist at the Munich University oncology oncology clinic, so a cancer clinic associated with the university in Munich. And he started interviewing all of the clients. And he found that prior to their diagnoses of cancer, they all had what he went on to call a biological conflict shock. So the criteria are generally that the felt sense is that it's isolating, unexpected, and acute. So the way we perceive it, and this can be, someone saying something to us like in a more minor sense, and if we, we're dwelling on it, we can notice, we can really use our awareness to notice when we're conflict active. So as soon as that conflict occurs, that's what we call the DHS here in the picture. So that's the Dirk-Hammer syndrome, named after his son, because that's what led to the discovery. We're into conflict activity. So this applies to, not only cancers, but really all of the different types of symptoms that we experience. So when we're conflict active, we're in a more sympathetic state. So, you can imagine you're going along with your life, you're more sympathetic, more alert in the day, more parasympathetic at night, everything's good, just naturally, a natural rhythm. And then this conflict shock occurs, and now we're put into conflict activity, it's called. So now we're locked in sympathetic, the fight or flight state, basically. So signs of this are that we're just thinking a lot. We're thinking about this issue. We can't stop thinking about it, even at night. It's hard to sleep, and the hands and feet can be cold, and we're not digesting as well, and we're conflict active. So as soon as that happens, adaptations begin to occur. So it's all mapped out through the embryological germ layers. So that's the different, types of tissue that we have in the body and the different brain regions. So
And we went into that last time quite in depth. So for anyone listening, you can refer back to my original conversation with Daniel, and we went into those different layers of the brain.
Okay, I'll move through that more quickly. So the adaptations occur, and then ideally we resolve the conflict in a timely manner. And the more aware we are, the easier it is to resolve the conflict, because we bring our awareness to it. We think, okay, that happened. Now I'm thinking about it all the time, and then just find a resolution, whether we have to make a practical change in our lives or we can switch our perception. We can shift our perception of those events. And then we move into the repair phase. And this is usually 80% of the time or so, they say, when we experience the symptoms. So whatever happened in the conflict active, whether we had tissue proliferation or tissue loss, depending on which, brain region or what type of tissue, it'll be restored. So tissue breakdown or the tissue restoration, and usually there's swelling and inflammation and discomfort, and sometimes pressure in the brain because there's a lesion in the brain that forms as well. Yeah, we go into it more in depth in the first interview. So anyway, as long as we can stay out of fear, that's a big part of it as well. Just knowing we're in the repair phase, listening to our bodies, allowing ourselves to rest, and we're in that parasympathetic state now. We will go back to homeostasis. When we have chronic conditions, the issue is generally that we haven't fully resolved the conflict and we keep getting triggered. So we're back and forth between conflict active and the repair phase. So yeah, so we'll continue on then. We did go into that a little more in depth in the first interview. So last time we went through the uterus and fallopian tubes.
And I just wanted to preface, Daniel. Okay, so we've decided to name this episode "Don't Chop Off Your Ovaries,"
Yes, good name.
because, and we'll kind of go into that, but I wanted to just notice that Dr. Hamar, so he went in for surgery and removed his testicle, and in hindsight realizes that he didn't have to actually do that. And I wanted to say that there's a correlation there with myself and my journey in getting a very large and having a very large ovarian cyst on my right ovary. And I did go in for surgery to have that ovary removed. Whereas in hindsight, I wish that I had just wrote it out a little bit longer. But at that time, I didn't know about German new medicine. And we're going to get into that today.
Yeah, it's tough, right? But we obviously can't dwell on the past. But yeah, the future generations will know it, and life will be so much more harmonious if, like when I have children one day, like I just look forward to them just living this from day one, even before, just what I'll be perceiving and my wife will be perceiving while we're having the child, and it'll just be so natural and everything will flow so much more harmoniously, life in general, so. Okay, so moving into the germ cells. So yeah, these are the cells that produce the eggs, basically. And then after that, we'll get into the hormone producing tissue. So the ovary germ cells. So I'll try not to get too deep into the weeds here, but so in the human reproductive organs, germ cells are the cellular units that give rise to gametes, so eggs and sperms, whether you're a man or a woman. The primordial germ cells, Dr. Hamar actually had the germ cell cancer when his son died, so, but in the testicles, of course. The primordial germ cells appear first in the yolk sac of the embryo, from where they migrate through the developing intestine to the new gonads, so testicles or ovaries. In the ovaries, the germ cells form so-called oogonia that are precursor cells to oocytes from which an egg or ovum develops. This process, called oogenesis, takes place during the development of the fetus. Thus, at birth, the female infant is born with the entire number of eggs. Starting with puberty, each month during ovulation, a mature egg is released into the fallopian tube for fertilization. After the discharge of the ovum, a corpus luteum, hormone-producing cell cluster in the ovaries secretes progesterone that helps to prepare the uterus and uterus muscles for pregnancy and to maintain gestation. It also plays a role in the development of the breast glands in preparation for nursing. The corpus luteum, as well as the germ cells derived from the endoderm, are controlled from the midbrain. So the midbrain is part of the brain stem. So they just like to tell us what type of tissue it is and which brain region it originates from. So And then the biological conflict. So this is that conflict shock. So this is the cause, essentially. The biological conflict linked to the germ cells is a profound loss conflict, often the loss of a child. So that was what happened with Dr. Hamar, of course. So during the conflict active phase, an ovarian teratoma or germ cell tumor develops from the corpus luteum. The significance of a teratoma relates to the primeval ability of parthenogenesis, the reproduction without fertilization. The biological purpose of the additional germ cells is to facilitate faster reproduction in the emergency of the loss of an offspring. In conventional medicine, a malignant teratoma is classified as an ovarian cancer. And there is another one related to the ovaries, like the hormone-producing tissue, which we'll get into next. Okay, and this is an interesting note. The cell proliferation that takes place with the growth of a teratoma is the same as it occurs in the development of the fetus. During the first 3 months of pregnancy, the cell increase follows the principle of the old brain-controlled organs with cell proliferation in the sympathetic state. So in the more fighter, in the first 3 months, they say you're more sympathetic. So starting at the 4th month of gestation, though, the cell proliferation follows the pattern of cerebrum-controlled organs with cell proliferation in vegetonia, so in the repair phase, like the healing phase. That's kind of the state we're in. Not to say that that is an actual conflict. In that case, it's just following that type of course. So healing phase. So now we've resolved the conflict, and that could be, by the purpose here is like to basically be able to produce, to reproduce more quickly, right? It's trying to provide a biological response to this problem. So, okay, we lost a child. Now we want to have another child to make up for that loss, basically. So that would be one way to resolve the conflict. Another way would be to bring awareness to the loss and make peace with the loss. And if we can find that resolution within, then that will be enough as well. And then we'll move into the repair phase, so the healing phase. With the conflict resolution, the teratoma stops growing only slowly since embryonic tissue develops in spurts. So during the healing phase, fungi or mycobacteria, such as TB bacteria, so that's tubercular bacteria, that's something that's within, it's not like a virus, may decompose the teratoma, provided they are available. So why they say that is because if we've taken too many antibiotics, often the bacteria aren't available anymore. So if we have taken a lot of antibiotics, it might be good to drink some raw milk or, kiss the dog or things like that. Just try to get the bacteria back into our body. So the swelling filled with pus presents as an ovarian abscess. The healing process is accompanied by night sweats. If the teratoma remains, the growth encapsulates. So again, if we don't have the necessary bacteria, like TB bacteria and things like that, because of all the antibiotics, then it may become encapsulated. So that's fine. It's not dangerous or anything, but it's nice to have the bacteria so we can just go through the full healing, break down the extra tissues, and go back to homeostasis. But if it encapsulates, that's okay. We don't have to worry about it. It's still fine. Yeah, if we have the night sweats, that's actually a good sign that we do have the bacteria. So if we ever get night sweats, it's a good sign because most likely you have the bacteria. So remarkably, an encapsulated teratoma had developed a dermoid cyst might contain structures such as hair, teeth, or bones.
Oh, it's okay if we are, it is okay if you go to the doctor and the doctor tells you that you have cancer of the ovary, right? It's then time to consider, have you experienced a loss, specifically a loss of a child, right? So this manifests within the body as this, what is perceived as something cancerous and it's going to kill you. Whereas if you change your perspective and follow the 5 biological laws of German new medicine, you can find healing without having to move through chemotherapy. But what I'm also hearing is that it's important to have a plethora of bacteria in your stomach. And this makes me wonder, why children are so sick. It's good that they're sick. I'm often hearing parents say they're getting frustrated because their kids are sick all the time, or it was a really difficult season of illness. My kids were constantly out with the flu and colds and bugs. And I always thought intuitively that it's good that they're having to build their like immunity and be exposed to these germs so that they're building up resistance, or they're building up bacteria that's going to help fight um, um, illness within the body. Is that correct, Daniel? And fight different viruses?
Well, a bit the way we would perceive, yeah, that's close. Like it's definitely not, the symptoms are nothing to fear. All the cancers or the, all of those, alleged viral symptoms you just noted, like the colds and the flus, those are all pretty much repair phase symptoms. So we've already resolved the conflict. So I would just recommend the parents, and what I would do is just, if the kids are getting sick, I'll look at what's going on in their lives. What are they perceiving? Why are they perceiving so many conflicts? Like maybe I'm, I can switch the way I'm parenting, or look at what's, if they're at school, who knows what's going on there. So yeah, it's just really looking at the conflicts and seeing how we can shift and bring more awareness to them. And everything just ends up being more harmonious in my experience. And really, like you said too, we're not fearing and fighting symptoms. Like all the cancers are all explainable through different conflicts. And it's nice because we know the conflict type that causes each type. And we also know the course it runs in the body. So it just really takes all the fear out of it. And we can just look at our own lives and find what conflict occurred and find the resolution that we need. That makes sense. Does it make sense?
Beautiful.
Yeah.
Yeah. So fascinating.
Yeah. So now into we already did this. Yeah. So we're into the ovaries and now into the hormone producing tissue in the ovaries now. So not the germ cells this time. So the ovaries are located at the right and left side of the uterus, to which they attach through cord-like ligaments. During a woman's monthly cycle, an egg formed from primordial germ cells, which we just went over, grows into a tiny sac called a follicle. At the time of ovulation, the follicle breaks open, allowing the ovum to be released and travel from an ovary through the fallopian tube to meet a sperm for fertilization. After about 6 days, the fertilized egg or blastocyte implants in the uterine cavity. The corpus luteum, a progesterone-producing cell cluster in the ovaries, facilitates pregnancy. The ovarian tissue contains interstitial cells resembling those of the testicles. The interstitial cells are responsible for the production of estrogen and small quantities of testosterone. Estrogen plays a significant role in a woman's sex drive and readiness to mate. The ovaries originate from the new mesoderm and are therefore controlled from the cerebral medulla. So again, they just get into the brain regions and they show us the actual location, because each of those brain regions we mentioned, they're all actually full of relays for different organs and tissues in the body. And this is where the ovaries are. So, if we had took a brain scan, when we had one of those ovarian cancers, we would see a lesion, a circular ring in a particular spot. And they have many, here's a brain scan right here. So we can see that's the spot. Okay, so we'll continue on. So the biological conflict, so again, this is the cause, what we're perceiving, linked to the ovaries is a loss conflict concerning the loss of a loved one. And this is the same for men with the testicles, hormone producing tissue. In comparison, the loss conflict related to the female germ cells is more of a primeval nature. The fear of losing a beloved person can already trigger the conflict. This conflict we're talking about. The same holds true for the loss of a pet. Constant self-blame following a breakup or the death of someone close can keep the conflict active. Women also suffer loss conflicts after miscarriages or coerced abortions. A loss conflict can be activated through an argument, betrayal, or unfaithfulness of a partner or friend. So the loss conflict related to the ovaries only concerns a person or a pet and not the loss of a home. So it's just, it's more personal. Conflict active. So now we're conflict active. So we've had this loss. It could be a breakup or, a fight with our children or parent, something like that. Necrosis, cell loss. So that's cell loss in the ovary. Because of the reduction of estrogen producing cells and the estrogen level decreases. So depending on the intensity of the conflict, prolonged conflict activity results in irregular periods. a delayed menarche, first menstruation, amenorrhea, so an absence of menstruation, or infertility until the conflict is resolved. And the cervix mucosa also can cause infertility. So there's two conflicts that can cause infertility, and this is one of them. So the loss of the unconceived child can lead to lasting infertility. And then they just have a note about whether the right or left ovary is affected, depends on the woman's handedness. Like there's a biological handedness that comes into play here, where if you're right-handed, your left side is mother-child and right side is partner side. And partners can include the father, the partner, other people not perceived as a mother or child. Although sometimes we may think we're a certain handedness and our biological handedness is different, so we don't have to get too hung up on that necessarily. On this brain scan, we see an active Hummer focus, so sharp ring target. That was the one we looked at a minute ago. So that changes throughout the repair phases. So it's sharp ringed in the conflict active phase though. So, and that's right in the area of the brain that controls the right ovary, as we saw right there. Compare with brain CT below. For a right-handed female, the related loss conflict is associated with a partner. For a left-handed female, with her mother or child, as I mentioned. And so it just switches depending on your handedness. So the healing phase. So now we've resolved the conflict. We've either had another child, we've conceived perhaps, or whatever we've needed to find the resolution within. We've made peace with the person, with our child or our partner, or we've just accepted the loss. So following the conflict resolution, the tissue loss is replenished with new cells, ideally assisted by bacteria such as Streptococcus bacteria. So healing symptoms are pain caused by the swelling, and inflammation or infection of the ovaries is called adnexitis. So a special characteristic regarding the healing of the ovaries is the development of an ovarian cyst. Provided there are no conflict relapses that interrupt healing, the process takes, like a pregnancy, 9 months to complete. So this is quite interesting right now. So during PCLA, so that's the first part of the repair, a fluid-filled capsule or cyst forms at the site of the necrosis. Just one thing I'll note on this one, all of the cerebral medulla controlled organs or tissues in the body, which this is, the benefit comes at the end. So it's almost like a test. Like we have to resolve this conflict and then we actually get a benefit. Like the tissues are made stronger, more robust. So we're better able to deal with a conflict of this type in future. So in this type, with water retention, so sorry, that was about the ovarian cyst that starts to form. So during the first phase, a fluid-filled capsule or cyst forms at the site of the necrosis. So now we're rebuilding. With water retention, which is called the syndrome, brought on by an act of abandonment or existence conflict that causes our kidneys to retain extra fluids. An ovarian cyst can become quite large since the retained water is exceedingly stored in the healing area. Large cysts cause considerable pain, particularly during menstruation and heavy menstrual bleeding. What is termed polycystic ovaries points to multiple loss conflicts resulting in many cysts. So in order to restore the cell loss that occurred during the conflict active phase, ovarian cells start to proliferate inside the cyst. At this early stage, the cyst attaches itself to a neighboring tissue for blood supply. Adhering to adjacent tissue also stabilizes the cyst. So detected during this period, the growth is diagnosed in conventional medicine terms as an invasive or infiltrating ovarian cyst, and wrongly assumed to metastasize to nearby organs. Based on the 5 biological laws, the new ovarian cells cannot be regarded as cancer cells since the cell increase is, in reality, a replenishing process. Okay, let's see here. So after the epileptoid crisis, we won't get into all that.
Okay, so but that note that you're
Yeah.
skipping over, I just want to
Yeah.
say, Daniel,
Yeah.
so when the doctor found the cyst on my ovary, or it was very obvious there was a cyst on my ovary, it was bulging out of my abdomen. This
Yeah.
was the one blood test that they wanted me to take, and my CA-125 levels were very, very high. So that was kind of like how they determined that this could be a potential risk. And
Okay. Maybe we should go through this then. Do you want to go through this note then? Is
Yeah,
that
because
or,
for anyone that has ovarian
yeah.
cysts and goes to the doctor with this symptom, this is the
Mhm.
blood test that they will take.
Yeah, okay, perfect. Let's go through it then, because that's good to know. Conventional medicine uses as a cancer antigen, cancer antigen called CA125 as a tumor marker for ovarian cancer. Like the PSA test, the CA125 test is unreliable and inconclusive. The problem is that while CA125 is produced by epithelial ovarian cancer cells, it is also made by normal cells. Some people have naturally high levels of CA125. In many cases, inflammation or irritation of tissues in the abdomen or conditions including uterine fibroids can cause CA125 levels to rise. Endometriosis, liver ailments, including hepatitis or cirrhosis, and pelvic inflammatory disease can also affect CA125 levels. On the other hand, 10 to 20% of ovarian cancer patients have normal levels of CA125 when their tumors are diagnosed. So one study found that among patients with stage 1 ovarian cancer, fewer than half had abnormal levels of CA125. So it's inconclusive anyway.
This test is just like, what's the right term? Erroneous? Is that the right term? It just doesn't even it doesn't even
Yeah,
say.
the more we study the German medicine, they keep coming up with this type of information where these tests are kind of useless, right? Yeah,
Wow.
or erroneous and not at all conclusive or indicative of anything. After the epileptic crisis, the cyst, so that's a part of the repair phase, kind of in the middle, the cyst has lost most of its fluid. So it says that because while we go into the repair phase, the lesion in the brain fills with fluid when we enter the repair phase, and the organs or tissues. That's probably why yours was swelling as well. But during the epicrisis, they call it kind of a big squeeze as well. It's often when we have more acute symptoms, not necessarily in all cases, but we could have a heart attack or an epileptic seizure for certain programs, not for this one. But it could be an intense period of the healing. But then when we get through that, that fluid has been expunged. So there's some relief and we move into the B phase of the repair. So in this case, in the B phase, the cyst becomes hard, separates from the neighboring tissue, and endowed with its own blood vessels, integrates itself completely into the hormone-producing function of the ovaries. So, and this is precisely the biological purpose. So, as I mentioned, in this one, you have to resolve the conflict to get the benefit and the purpose. The boost of estrogen provided by the cyst makes the female who has lost an offspring or a mate more attractive, increasing at the same time her readiness to mate, which puts her into an ideal position to make up for the loss and become pregnant again. Or so you can attract another partner, you're more feminine, more fertile. Apparently, if you have these, you can often go through menopause later too, like 60 instead of 53 kind of thing. So it's kind of a nice little boost. So note, yeah, all organs that derive from the new mesoderm, so that's what we're looking at now, including the ovaries, show the biological purpose at the end of the healing phase, as I mentioned earlier. So in this brain CT, it shows swelling, edema in the brain relay of the right ovary. So this one, let's see here. Pushing into the left lateral ventricle. The CT confirms the presence of an ovarian cyst on the organ level. Okay, it's just another brain CT. So if the pressure in a liquid or semi-liquid cyst becomes too strong, the cyst might burst. Water retention due to this syndrome. So it is important to know about this one they call the syndrome I mentioned before. It's the kidney collecting tubule program. So if we're feeling isolated, abandoned, like we don't belong, so it's called an existential or abandonment conflict, it can become triggered and it makes the repair phases of other programs, the symptoms more acute, basically, because of the extra fluid, there's more swelling. So it's nice to be aware of so we can try to resolve that, so we don't go conflict active with that. Unfortunately, often people go to the hospital and then that causes it because, they're not at home, they're feeling isolated and it's not the nicest environment. So a blow against the abdomen, a fall or accident, exploratory puncture, or premature surgery can cause the rupture. When the cyst breaks, the fluid passes into the abdominal cavity with the released ovarian cells attaching to the abdominal wall or an abdominal organ such as the bladder or rectum. In this case, the cyst development takes place outside the ovary. This is what is erroneously called or termed endometriosis. A cyst that forms within an ovary is called an ovarian endometrioma. If such a cyst contains old menstrual blood, this is referred to as a chocolate cyst due to the brown tar-like color or the fluid-filled cyst cavity. According to conventional medicine, endometriosis is a growth of the endometrial tissue outside of the uterus. However, Dr. Hummer's brain scan analysis demonstrate that every woman with endometriosis shows the Hummer focus, not in the brainstem from where the endometrium is controlled, but rather in the cerebral medulla, namely in the area of the brain that controls the ovaries, so that we looked at here. This also explains why endometriosis increases a woman's estrogen level, a fact that so far could not have been explained. In here, they just say, I guess Fox News reported that women with severe endometriosis may be more attractive. So
Hey, not a bad thing, not a bad
yeah,
thing.
exactly. Yeah, because again, the purpose is to make the woman more fertile, more feminine, more able to attract another mate, have another child. So trying to provide a solution to this conflict. Dr. Hummer strongly advises that an ovarian cyst should only be removed when the cyst is fully matured, which they say takes about 9 months in this case. Surgery on a semi-liquid cyst disseminates the ovarian cells in the abdominal area, causing unnecessary complications. In conventional medicine, the spreading tumor cells, quote, spreading tumor cells, are usually interpreted as metastasis. Moreover, the announcement of the surgery and the actual operation might trigger an attack conflict, resulting in the development of a peritoneal mesothelioma, a tumor on the abdominal wall at the site of the surgery. So the fear of cancer and hospitalization can provoke an existence conflict, leading to the development of ascites, so water retention in the abdomen, which is often seen in women after diagnosis with ovarian cancer. So kind of what they're referring to there is that often we get this one fear, scary diagnosis basically, and then it just can lead to a cascade of other conflicts like that kidney collecting tubule one I mentioned, or this situation here. So we're retaining extra fluids. So the awareness makes a big difference, because then we're not in fear and we're not getting all these extra conflicts, because in many cases, as soon as the woman gets that cancer diagnosis, right then they're getting another conflict. You can see how it could easily trigger that existence conflict affecting those kidneys, and now we're retaining more fluid, making things more complicated. So one other note here, the removal of the ovaries habitually performed with a hysterectomy drastically changes a woman's hormone status and subsequently her biological identity. The amount of estrogen produced in the adrenal glands is not sufficient to compensate for the loss of estrogen produced in the ovaries. So there are certain conflicts like this one that can cause a woman's hormone status to switch, meaning that she's perceiving in a more masculine way, because through German medicine, there's a masculine way of perceiving and a feminine way, but there's certain conflicts that can cause the man to perceive in a feminine way and the woman to perceive in a masculine way. Or actually, when a woman is, pregnant, she's perceiving in a more masculine way too, which is more territorial, like, she's wanting to defend her territory, her new baby kind of thing. Or after menopause, she's perceiving in a more masculine way as well. So that they're just saying that if you get those ovaries removed, that can switch that as well. And taking hormonal birth control, which obviously now with what we know, we probably all know is not a good idea, that causes that switch as well. So,
Detrimental effects on the body and long-term effects, you know what I mean? We have to really think hard when we're being faced with these diagnoses, and also the doctors are wanting to remove organs and parts of our body. We are this really beautiful system. Everything works together, and when you take one piece out of the jigsaw puzzle, it's not as pretty. There's a lot more conflicts to resolve in that case, right? There's a lot of women that are getting hysterectomies and removing their organs. And even for myself, I was there, like I had the surgery done, I removed the ovary. I will say though, it was over 9 months. So that makes me feel a lot better learning this today with you, Daniel, that if you are going to do it when the
Yeah,
cyst is well and mature. But yeah, when we remove these parts of our body, it causes conflicts or other conflicts.
yeah, yeah. It's definitely not, yeah, we're not designed to be cut apart and everything, right? So it's too bad. And again, with the hormonal birth control, like it's crazy because they're, kids, young girls are taking it at what, 13, 14. So then that's switching them to perceiving like a man, and they're just going to develop differently, right? So,
Yeah, and
it,
these hormonal birth controls don't allow the young woman to have menses, right? Like she's not able to shed her endometrial lining. And so there's a lot of toxicity and stagnation. And in Chinese medicine, it's stagnation of the qi, like there's not enough energy moving through her body. And that
makes
can
sense.
cause lots of effects in future as well.
Yeah, yeah. And it makes sense why a lot of women are maybe a lot more in their masculine now, because they've been kind of guided there, unfortunately, yeah, by some of these things in society. And then there's a little note here. More than 600,000 American women this year will undergo a hysterectomy. So that seems crazy. Or removal of the uterus. That rate is among the highest in the industrialized world. By age 60, 1 in 3 women in the US will have had this surgery, which is crazy. And in more cases than not, they will have also had their ovaries and fallopian tubes removed during the procedure. Doctors have long turned to hysterectomy as a treatment for conditions that range from heavy periods to ovarian cancer, but its widespread use concerns some critics who say it's tantamount to female castration. Yeah.
And you're not getting to the root of the issue if you're just putting a band-aid on it and removing the whole uterus or removing the ovaries and the fallopian tubes. You're, like I said earlier, and what we're talking about is you're just going to create more problems. Why not go into the root and meet it head on?
Exactly. Yeah. I just did this recall healing level 3 course last weekend with Gilbert Renaud, and it uses this as the foundation, but it adds so much more with looking at a life timeline and things that happen when we're in the womb and family tree stuff. And anyway, he just made a comment that, yeah, conventional medicine, all they really do is like cut, burn, or poison. You know what I mean? Those are the answers essentially. So unfortunately. Okay, so cervix mucosa. So this is the other one that can cause that, the infertility basically. So that's cervix mucosa controlled by the cerebral cortex, ectodermic tissue. Just a little diagram here. So the cervix uteri, or neck of the uterus, is the lower portion of the uterus that leads into the cervical canal. The orifice of the cervix opens into the top end of the vagina, allowing sperm and menstrual fluid to move through. The cervix is surrounded by a cylinder-shaped muscular structure, the orifice by a sphincter muscle. The inner lining of the cervix is a mucous membrane that secretes fluids, mainly water, to keep the cervical canal moist. The cervix mucosa consists of squamous epithelium, originates from the ectoderm, and is therefore controlled from the cerebral cortex.
Oh, it looks like Daniel.
Below the coronary veins.
Oh, sorry, Daniel. You
Yeah.
got we lost you there for about
Oh no.
20 seconds.
Okay. The talking?
Yeah. Maybe
Okay.
just go back like 20 seconds.
Okay. So I think we got through the first bit here.
Yeah.
And here they're just saying that the cervix mucosa is controlled from the left insula. So that's a part of the temporal lobe in the brain, basically. And here is this diagram that shows the exact location. So yeah, it shares that relay with the coronary veins. And so it just kind of gives us a little diagram of the brain there. So the cervix mucosa and coronary veins share the same brain relay and therefore the same biological conflicts. Hence, in females, the biological special programs run simultaneously. And the conflict for this one, the biological conflict to the link to the cervix mucosa, is a sexual conflict or a mating conflict, meaning in biological terms that reproduction is at stake, or a territorial loss conflict. That's if we're perceiving in a more masculine way. So if we've had some other conflicts that have switched things. In comparison, the conflict associated with the uterus is foremost about implantation. In males, the sexual conflict corresponds to the coronary veins, so with a low testosterone status, or to the prostate when the testosterone level is in the normal range. So I know it can be a little hard to understand at the start of the terminology, and what this gives us a little chart here, because this is where the right-handed and left-handed thing comes into play. So for a right-handed female, the sexual conflict will affect the coronary veins and the cervix uteri. And for a left-handed female, the sexual conflict will affect the coronary arteries. And that's with normal hormone status. And if a woman has low estrogen status, so this could be from taking the hormonal birth control or certain conflicts are running that have caused that, then it becomes a territorial loss conflict because they're perceiving in a more masculine way at that time. So a sexual conflict refers to any distress concerning sexuality. This includes painful first-time sex, painful or first-time sex potentially, sexual abuse, sexual harassment, unwanted sexual practices, sexual rejection, feeling sexually unwanted, a lack of sexual activity because of an unexpected separation or loss of a mate. So here, we're all unique, so it just depends how we each perceive the situation. We're unique in the way we perceive. Offensive pornography, finding out that the partner or spouse is sleeping with someone else, or interruptions during sexual intercourse can trigger the conflict. As a result of early sexualization, girls experience nowadays the conflict at a very young age. Tubal ligation, so tied tubes, the use of an IUD, or taking contraceptives to prevent a pregnancy might invoke a sexual conflict on the subtle psychobiological level. So if a woman has a low estrogen status, for example, after menopause, she's no longer able to experience a mating conflict in biological terms. She will therefore respond to sexual distress with more likely the uterus. This explains why, according to epidemiological studies, 90% of women with uterus cancer are over 50 years of age. Okay.
Yeah,
So
that's really interesting.
yeah, so it can, unfortunately, a lot of younger women do get these sexual conflicts, and then, that switches them to perceiving in a more masculine way often. So then it can really be disruptive as they're developing. And this is just showing basically the pattern that it runs. So when we're conflict active, there's numbness, and then in the repair phase, there's pain, except for the epicrisis in the middle where there's numbness again. So that's called the outer skin sensitivity pattern. It just helps if we ever had one of these conflicts, we could know what to expect throughout. Does that make sense at all?
I'm just trying to
Yeah.
understand
Yeah. Yeah.
I'm trying to understand so we know that the conflict is there's an issue with sexuality because of
Mhm.
these certain situations, or she's on hormone or birth control. Um, and what is being presented is on the skin, on like the organ of the skin, or
Oh,
it's inside her vagina.
yeah, that's good. Good to clarify. Outer skin sensitivity pattern is just a pattern of basically numbness in the conflict active phase. So it's just following that pattern, because there's also a gullet mucosa sensitivity pattern, which is the exact opposite. So it's just a sensitivity pattern. So numbness, pain, whereas the
Uh,
other one is reversed. So it's just telling us, that's what they call it in this case. So it is inside. That's all happening in the cervix.
So for
So
women that are being diagnosed with things like pelvic inflammatory disease or just general pain during intercourse, um, this is the symptom of the specific
it could
conflict.
be, yeah, it could be that they're in the repair phase,
Or
perhaps.
bleeding and itching. I'm seeing, okay, so like spotting
Mhm.
when you're not in your menstrual phase or having an itchiness, so maybe some yeast infection or UTI, or UTI would be something different, but um,
Yeah.
yeah.
Yeah, like an example would be maybe they have sex and they get the conflict, and they're in numbness, and then they come into the repair phase and they're having this, and then they
Mhm.
have sex again, and then maybe the conflict happens again, and you can see how it could become a recurring thing, You
Yeah.
don't feel you get
Especially if you're
like it.
having sex with the person who who you're in conflict with, right?
Yes, exactly. So it's just noticing what is triggering us, and things can become associated with it too, that then trigger us as well. Like, maybe it gets to the point where just texting with that person triggers it, for example.
Wow.
So just to be aware of what's going on in our experience. So in the conflict active phase, there's ulceration of the cervix mucosa proportional to the degree and duration of the conflict activity. So again, that's where the awareness can make a big difference, because if we notice we're conflict active, we can downgrade it and hopefully resolve it much more quickly. And then there's going to be less ulceration and then less repair phase symptoms. So the biological purpose of the cell loss, so there's always this purpose, like the body trying to provide a biological solution, is to widen the cervix. So when mating takes place, more sperm can reach the uterus, which enhances the chances of conception, because that's one of our primary purposes here. The conflict affects at the same time the coronary veins. The ulceration of the coronary veins, intima, causes moderate angina pectoris. So this conflict is also affecting those coronary veins in the heart. This CT scan shows a Hummer focus in the area of the brain that controls the cervix. The sharply defined border indicates that the woman is conflict active with a sexual conflict. So we can see it's quite sharp, the ring, so it's still in the conflict active phase. With the impact of the conflict in the left temporal lobe, the estrogen level decreases. So in GNM, we speak in this case of a conflict-related hormonal imbalance. Depending on the intensity of the conflict, lasting conflict activity results in irregular periods, a delayed menarche, or infertility until the conflict is resolved. So we can resolve it. So if we do find that resolution, now we enter the healing phase. So whatever we need to feel that resolution, whether we have to make a practical change in our lives or make it perceptually. During the first part of the healing phase, the tissue loss is replenished through cell proliferation with swelling due to the edema, which is the fluid accumulation in the healing area. In conventional medicine, a profuse cell proliferation is diagnosed as a cervical cancer. Based on the 5 biological laws, the new cells cannot be regarded as cancer cells, since the cell increase is in reality a replenishing process, making up for what we lost. Healing symptoms are pain and bleeding from the cervix, ranging from mild to severe. There might also be some yellow discharge due to bacterial activity. A prolonged intense healing process, so a hanging healing, this is when we keep getting, or we maybe are getting triggered back and forth, causes long and heavy menstrual periods. Throughout the epicrisis, so that's that acute part in the middle of the repair, the muscles in the inner wall of the cervical canal contract with painful cramps. Other symptoms of the epicrisis are a rapid heartbeat, since the coronary veins undergo the healing crisis at the same time. So in PCLB, the swelling in the cervix slowly subsides, so does the bleeding and the pain. Cervical warts, also called genital warts or condyloma, are the result of continuous conflict relapses. So the PAP test is a cancer screening test that checks for changes in the cervical tissue. Hence, the test can be positive, so quote, precancerous, in the conflict active phase, ulceration in the cervical mucosa, as well as in the healing phase, restoration of the mucosa. None of these changes are abnormal, but occur naturally during the 2 phases of the special biological program. As the PCA test, a PAP test is just a marker indicating the degree of conflict activity or healing. So it's just, I mean, we don't really recommend in German medicine that anyone take a PAP test, really, and especially if you're not having symptoms, and it's just, or if you do get it, just get it for your own knowledge and knowing, to get a little more diagnostic, better diagnostic of what's going on.
And if anything, these precancerous cells that they're seeing through the pap test just give you concrete evidence that you're in the repair phase.
Yeah, generally. Yeah, exactly. It sounds like even sometimes they call the precancerous, they're saying that in the conflict active when there's actually just ulceration going on too, right? So it's just telling you you're conflict active and to resolve your conflict. And it seems like a lot of women are getting this precancerous thing, and then someone told me they were recommending like electrocuting, doing some little electrotherapy on it. And then she was
on their
looking,
cervix.
yeah, and she was looking it up, and all sorts of women are having horrible, of course, side effects from that. So she didn't get it. But yeah, so
Wow.
it's just good to be aware of. The medical industry claims that cervical cancer is caused by the so-called human papillomavirus, allegedly transmitted through sexual contact. In 2006, the FDA approved the vaccine Gardasil to supposedly protect teen girls against the cervical cancer. The vaccine is also imposed on boys at the ages of 9 to 12 to prevent the spread of the HPV infection. So that's just not actually it. And we don't recommend anyone take any vaccines, and there's no viruses. And especially not for little babies, because I mean, really, just the process is not natural, right? That the parents would hold the baby and then let some guy come and stab the baby with a needle, even if there's nothing in it, that might be toxic as well. That's potentially traumatizing and causing autism and things like this, right? Could be a conflict they
Well,
have resolved.
yeah, and this is a really it's interesting that you're bringing this up right now, Daniel. It's on our interview today because later on this afternoon, I'm going to be interviewing Dr. Taylor Bean, who's a naturopathic doctor, an immunizing naturopathic doctor, and I have so many burning questions for her in regards to childhood immunizations and do they cause these things like autism and other questions just around the Tdap vaccine. So yeah.
Good.
For anyone
Perfect.
listening to this
Yeah.
episode now, there's probably already an episode out there launched with Dr. Taylor Bean. Highly recommend this conversation.
Awesome. Yeah, because what we tend to say is that, I mean, there's conflicts that can basically just stop the emotional development of the child, basically, right? And you could see that it's called constellations when you get a couple, but things like, we believe, circumcision and vaccines cause them because of the conflicts, because it's just very unnatural, right? And you can see how that's going to be traumatizing to the child. Most of us obviously resolve those conflicts, but some never do, and they're stuck with things like autism,
So it's
where they're
not
just,
actually well, it could be the cocktail
it
or
could be
whatever
both.
is in that
Yeah,
inoculation, but it's the event, the sharp object going into that young infant's body, like that whole event, which causes the conflict.
I think, yeah, and I think we a lot of us do think that, and we think also that's why there's more boys who have autism and things as well, right? Because they also, a lot of them get circumcision, which is
Mhm.
similarly unnatural thing happening, really, right? So yeah,
Genital mutilation. Yeah.
yeah, totally. Okay, continuing on. Cervical muscles and cervical sphincter. Okay, so I'll try to cruise. Do you want me to try to cruise through a little more quickly? Because we wanted to go about another half hour or so.
Yeah, for sure. I'm just
Yeah.
soaking this all in. I love studying
Okay.
this
Okay.
information with you.
Can always do another one if we don't finish and you want to do more one day. The cervix is surrounded by a body of muscles with a sphincter muscle at the opening into the vagina. During labor, the cervical muscles contract and the sphincter opens to aid the delivery of the child. The same occurs during the female orgasm, where the cervical sphincter relaxes so that the penis can penetrate easily into the cervix with the cervical muscles holding the penis tight. The cervical muscles and the cervical sphincter are composed of striated muscles, originate from the new mesoderm, and are controlled from the cerebral medulla and the motor cortex. So this is interesting in that it's just saying that there's two different relays. So the cervical muscles, like themselves, are in the cerebral medulla, and pretty much all the bone, joints, ligaments in the body are controlled from that cerebral medulla area, and that's the one where we get the benefit at the end. So if we ever have aches and pains in the body, like in the back or the hips or whatever, the shoulder, it's generally because we've resolved the self-devaluation conflict and it's rebuilding. So that's a nice switch as well, where we're not like, oh, okay, I have this pain in my neck, I don't need to get down on myself further, I just have to know that I resolved it, a moral intellectual self-devaluation conflict in that case, and it's repairing. And so that's going to be the same for these muscles as well. But in this case, the muscles are from the cerebral medulla and the control is from the cerebral cortex. So the signals for controlling them. So that's why there's two brain regions. Okay, so the biological conflict linked to the cervical muscles and cervical sphincter is not being able to sufficiently hold the fetus. So that could be difficult pregnancy, fear of miscarriage, abortions, or not being able to hold the penis tight enough during intercourse. So the conflict is, I know it sounds like funny conflicts, but it's just what we're perceiving kind of thing, just to give us an idea. The conflict is similar to a self-devaluation conflict, which are most of the themes for that cerebral medulla. So conflict active phase. So we're conflict active now. We have cell loss, so necrosis of the cervical muscle tissue, and proportional to the degree of conflict activity, increasing paralysis or weakness of the cervical muscles. So that's why we have the two regions. So we have tissue loss, so that's the cerebral medulla tissue. And then we have this paralysis, and that's from the motor cortex of the cerebral cortex. At the same time, the cervical sphincter opens because of the lack of control there. So let's see here. Healing phase. So now, if we've resolved the conflict, during the healing phase, the cervical muscles are reconstructed and the cervical canal sphincter closes. The epileptoid crisis presents as cervical spasms.
And
So
now during the healing phase, she's able to have multiple orgasms.
yes, exactly.
Have
Yes.
super strong cervical tissue and sphincter action.
Yeah, that's a good point. Yeah, because you get all organs that derive from the new mesoderm, which we're dealing with here, including the cervical muscles, show the biological purpose at the end of the healing phase. After the healing process has been completed, the organ or tissue is stronger than before, which allows being better prepared for a conflict of the same kind. Oh, is this the note about let's see, the female orgasm? During the female orgasm, the cervical sphincter opens while the cervical muscles contract. When the male ejaculates, the sucking movement of the cervix helps to draw the semen into the uterus. The cervical orgasm is initiated from the female conflict area on the left side of the cerebral cortex, precisely from the brain relay that controls the cervix mucosa. At the height of the orgasm, the entire left temporal lobe becomes involved, including the larynx. These are just different brain relays that are in that left temporal lobe, and the rectum. So that's the larynx, that's the gasping, and the rectum. Both the clitoral orgasm and penile orgasm are controlled from the right side of the post-sensory cortex. The rectal orgasm is controlled from the left side.
So this
Interesting.
is a huge note for people that are dealing with infertility, both male and female, right? If we're having challenges in conceiving, it could be because of these conflicts within ourselves. And what we're learning through this is that the person doesn't necessarily have that much belief in themselves, or I forget the term of when they're
Well, we say the self-devaluation. Yeah, often.
self-devaluation.
But it's probably more the last one that we went over with the ovaries, or the one before. Well, it's mostly for infertility for the women. It's mostly the cervix mucosa one. So like that sexual, conflict or mating conflict, and the one before, so the loss conflict. Those are the ones that we find cause the infertility, all the infertility basically.
Okay.
Yeah. But yeah, it's true. I mean, any of these are going to make things more challenging, really, aren't they? And the conflicts down there. So yeah, just trying to be very aware. So
So for any of you
Bartholin's
that
one.
are having a hard time reaching orgasm, it's an issue of self-devaluation. You got to get on your confidence. You got to work on on feeling good about yourself, girl.
And all the sexual conflicts. So the sexual conflicts, the mating conflicts, or the losses, looking at the losses, the breakup or things like this. So yeah. And yeah, if if anyone ever is coming to you with these issues, just let me know, and we can go over it. I can send you more info, or we can talk about it and look at what it might be.
Because you said it could be a myriad of conflicts as well. It could be what you're considering the constellation. We have to look at the whole constellation to see
Yeah,
are
yeah.
playing to each other.
Yeah, the constellations are really an interesting thing, and I still have more to learn, of course, on everything, but if you have one on the right and the left, and they put the hemispheres out of sync, and they cause these behavioral changes, and it's kind of trying to help us because it's thinking that this is too much for us to deal with. But yeah, some of them often they can stunt our emotional maturity, basically. So we've all probably had them, to be honest, at some point with the way our society is. But moving forward, we'll hope to raise children that don't have any of them, and they're just, fully emotionally mature. We can see it often when people get emotionally triggered, if all of a sudden they're behaving like they're 6, like we
And they're
probably
just running this program. They've been running this program since they're
yeah.
6 years old.
Okay.
That conflict was never resolved. That issue
Mm.
was never resolved, and they're still emotionally triggered like a 6-year-old. And even if they're in their 50s or 60 years old.
Yeah, you see it in old people. Like, it doesn't matter the age. Once they get triggered emotionally, they're taken back to that, to that age, basically. So the Bartholin's glands are located on each side of the opening to the vagina. Equal to the smegma-producing glands that lubricate the penis head, the function of the Bartholin's glands is to secrete mucus to lubricate the vagina entrance in preparation for sexual intercourse. The Bartholin's glands consist of intestinal cylinder epithelium, originate from the endoderm, and are therefore controlled from the brainstem. So they just show us where the glands are here. Down here, actually, the Bartholin's glands.
Okay, so this could be for someone who's experiencing vaginal dryness.
Yes. Yeah. Another note here, the Skene's gland situated on the upper wall of the vagina is the equivalent to the male prostate gland. The secretions produced by the Skene's gland contain prostatic fluid, including PSA. As with the prostate, the ducts of the gland open into the urethra. During sexual arousal, the fluid is expelled through the urethral opening, explaining female ejaculation. Interesting. Okay, brain level. The Bartholin's glands are controlled from the left side of the brainstem. The control center is located next to the control center of the rectum submucosa. So it just shows us the relay location in the brainstem. So into the biological conflict now. So the biological conflict, so this is the cause, linked to the Bartholin's glands, is not being able to produce sufficient vaginal mucus. Insufficient foreplay and painful sex when the vagina is not lubricated enough typically activate the conflict. So starting with the DHS, during the conflict active phase, cells in the Bartholin's glands proliferate proportionally to the intensity of the conflict. The biological purpose of the cell increase is to augment the secretion of vaginal mucus to facilitate easier penetration. So in this case, actually, once we get, once we're in conflict activity, we're going to produce more. So it's trying to help us, if we're having this painful sex. But of course, really, we want to look at why we're having that conflict in the first place.
Well, she's
Not
running a program and she believes that she's not able to produce enough vaginal mucus. Okay.
Yeah, true. Yeah. Or like, because guy just comes and doesn't do any foreplay, just shoves it in, then that's what you're kind of perceiving, right? Makes sense. Healing phase. Following the conflict resolution, fungi or mycobacteria, such as TB bacteria, remove the cells that are no longer required. If the healing process is intense, the accumulation of pus forms an abscess or a fluid-filled cyst that empties spontaneously during the epileptoid crisis. With concurrent water retention due to the syndrome, so again, that's that active abandonment or existence conflict, the abscess or cyst might occlude the duct exiting the gland, so block the duct. So when fungi assist healing, this causes candidiasis. The fungal discharge produced during the cell removal is excreted through the vaginal opening. Note, vaginal discharge originates in the Bartholin's glands and not, as assumed, in the vagina, since the vaginal canal is not endowed with endodermal submucosa and subsequently not populated by fungi or TB bacteria. Frequent conflict relapses lead to a loss of glandular tissue, resulting in permanent vaginal dryness. So that would be if we're back and forth between conflict activity and repair phase, eventually we could lose some of our function. Like other so-called venereal diseases, candidiasis is not contagious. If the male partner happens to have the condition as well, this reveals that he experienced at the same time the conflict of not being able to penetrate a tight or dry vagina with subsequent penile candidiasis in the healing phase. And then the note, antibiotics also cause vaginal dryness. They destroy the normal vaginal flora that is largely inhabited by lactobacillus acidophilus bacteria. The fungal infection is brought on by the side effects of the medication. The candidiasis symptoms occur in the healing phase or after the antibiotic treatment is over. Further treatments create a vicious cycle.
Okay, so note, ladies, a yeast infection is your body healing itself. That's what I'm hearing. Because
Yeah, yeah, yeah.
candidiasis is a yeast infection. So
Yeah.
the overproduction of a certain fungus that is actually creating not a band-aid, but a solution to the
Yeah.
conflict.
Yeah, it's the repair phase. And even if we have, like candida overgrowth and all this is likely because we had an indigestible morsel conflict, like in the digestive tract, something that's not healing though. And in this case too, if it's an issue, it's probably because we're getting triggered, we're back and forth between the conflict active, the repair phase, and now it's quote chronic, a chronic condition. So it's just that we're not resolving the conflict. So then we just have to look at our life and look at the triggers. Well, maybe it can be a bit tricky if it's been going on for a while because there could be a lot of triggers, what we call tracks, things that can trigger us back into conflict activity. So it's like a bit of detective work. Okay. So now into the vaginal mucosa. So cerebral cortex, ectodermic tissue, vaginal mucosa. So the vagina is the passageway that leads from the cervix to the exterior of the body. The outside wall of the vagina is composed of muscles. The interior surface is a layer of connective tissue, allowing for greater elasticity during sexual intercourse and childbirth. The mucous membrane of the inner lining maintains a steady moisture in the vaginal canal. The vagina itself has no glands. However, blood plasma seeping through the permeable vaginal walls keeps the vagina moist at all times. When a woman becomes sexually aroused, the increased blood flow to the area causes more fluid to seep through. The Bartholin's glands produce mucus at the opening of the vagina to facilitate the penetration of the penis. The vaginal mucosa consists of squamous epithelium, originates from the ectoderm, and is therefore controlled from the cerebral cortex. Okay. So it just shows us the locations of these. So the vaginal mucosa is controlled from the sensory cortex, so part of the cerebral cortex. And it's just saying that the right half is controlled from the left side of the cortex and vice versa. Except for the brainstem, all the other brain regions, there's this crossover correlation from the brain to the body. And I'm not 100% why there's a crossover correlation. There just is, except for the brainstem. I've tried to figure that out, but I haven't yet got if we have a good answer as to why it went that way. Biological conflict. The biological conflict linked to the vaginal mucosa is a sexual separation conflict associated with the vagina. Similar to a sexual conflict related to the cervix mucosa, a woman can suffer the conflict through the unexpected loss of a sexual mate, sexual rejection, her partner's impotence, or when she finds out her man is sleeping with someone else. The suspicion that her partner has sexual contact with another female can already trigger the conflict. Conversely, a sexual separation conflict refers to not wanting to have sex, for example, because of a lack of emotional intimacy, painful intercourse, insufficient foreplay, unwanted sexual practices, or a fear of getting pregnant. The fear of contracting a venereal disease can also provoke the conflict. So yeah, so again, we don't believe there are any STDs, they're just all conflicts. And of course, it makes sense that there would be a lot of conflicts associated with sex because of all the fear mongering and the shame and it's just an emotional situation. So this is just saying that it's following that same outer skin sensitivity pattern. So just so we know what to expect, numbness in the conflict active because there's the ulceration and the pain in the repair phase for the most part, except the epicrisis. So conflict active phase. So we have an ulceration, so tissue loss in the vaginal mucosa with a decrease or with intense conflict, with a decrease or with intense conflict activity, a complete loss of sensitivity. Okay. The vaginal hyposensitivity, so the numbness, serves the biological purpose of not being able to feel anything in order to be better able to cope with the sexual separation. And also there can be some short-term memory loss potentially with separation conflicts. So it's trying to help you deal with this situation. Ongoing ulceration in the vagina leads to vaginal dryness. For women who are sexually active, pain during the intercourse causes usually new sexual separation conflicts together with the distress of not being able to produce sufficient vaginal mucus. As a result, the vaginal dryness becomes chronic. So the healing phase. So now we've resolved the conflict. During the first part of the healing phase, the ulceration is replenished through cell proliferation, healing symptoms, and vaginal dermatitis with vaginal itching and pain. With an inflammation, the condition is called vaginitis. The vaginal discharge is clear, potentially with some light bleeding. When bacteria assist healing, the discharge is yellow. So after the epicrisis, so that's that intense part of the healing, in PCLB, the condition normalizes, provided there are no conflict relapses. Vaginal herpes are blisters and sores in the vagina. According to conventional medicine, genital herpes is a sexually transmitted disease caused by a herpes virus, a theory that has never been scientifically proven. Like other venereal diseases, genital herpes cannot be sexually transmitted since the symptoms are already healing symptoms. So these are just repair phase symptoms from the sexual separation conflict. Vaginal warts, also called genital warts or condyloma, are the result of continual conflict relapses. So we're back and forth being triggered all the time. So yeah, so anyone with the herpes, it's just repair phase symptoms of the conflict. It's not a virus.
You got to work on the relationship that you have with the person that you're having sex with.
Yeah, and watching out. Like if you ever do have the symptoms, we can think, okay, what happened before? What was it that triggered me? What kind of separation? Maybe feeling rejected even, or things like this, So, yeah, we just have to look at what we were experiencing. Okay, so now vaginal muscles. So we're nearly at the end. The vaginal muscles surround the entire vaginal canal. Their function is to hold the penis during sexual intercourse and to expand and contract throughout labor to facilitate delivery. The vaginal muscles are striated muscles derived therefore from the new mesoderm and are controlled from the cerebral medulla and the motor cortex. And also, I'll just mention, Madison, I'll send you this, and I think you have the website and stuff anyway, but just so you have all of this info and you can always reference, or if you're helping your clients out, brain level. The vaginal muscles have two control centers in the cerebrum. The trophic function of the muscles responsible for the nutrition of the tissue is controlled from the cerebral medulla. The contraction and expansion of the muscles are controlled from the motor cortex. And then they're just saying they do have the crossover correlation. So they're just telling that there's two brain regions involved here, one for the actual muscles themselves and feeding the muscles and building the muscles, and then one for the control. Biological conflict. The biological conflict linked to the vaginal muscles is not being able to hold the penis or not being able to prevent vaginal penetration. So thinking forced sex, unwanted sex, a fear of sexual intercourse because of discomfort or pain or pregnancy. Conflict active phase. So tissue loss of the vaginal muscle tissue and proportional to the degree of conflict activity, increasing weakness of the vaginal muscles. So usually this is unnoticed. Healing phase. In the healing phase, the vaginal muscles are reconstructed. However, during the epicrisis, the muscles contract, causing tonic-clonic vaginal cramps, a condition known as vaginismus. The distress associated with painful intercourse can become a tract, resulting in symptom relapses. So that's like a trigger, basically. So yeah, we always want to try to notice if certain things are triggering us, and then see if by bringing awareness to them, we can resolve them and clear them. And again, the purpose is at the end where the tissues are made stronger. Okay, glans, clitoris here. So the clitoris is situated within the front junction of the inner labia, above the opening of the urethra. The clitoris is made up of the glans, the clitoral shaft, and the clitoral hood. The clitoral glans consists of squamous epithelium, originates from the ectoderm, and is therefore controlled from the cerebral cortex. The clitoral shaft is equivalent to the penile corpora cavernosa that extend from the lower branches of the pubic bone to the penis head. In females, the two cavernous bodies are located underneath the outer labia. The crura are projections of the corpora cavernosa. Like the corpus spongiosum of the penis, the vestibular bulbs of the clitoris are erectile tissue composed mainly of smooth muscles. So they have a little diagram here. It's interesting. Brain level. The glans clitoris is controlled from the postsensory cortex. The epidermis covering the glans is controlled from the sensory cortex. So it's just showing us the brain relays here. Biological conflict. The biological conflict linked to the glans clitoris is a severe sexual separation conflict associated with the clitoris. For example, through the loss of a sexual mate or sexual rejection. See also sexual separation conflict related to the vagina and the epidermis of the external genitals, which we already went through. The conflict also refers to not wanting to be touched at the clitoris. So sexual abuse, sexual molestation, resistance to oral sex, unpleasant clitoral stimulation, or not being allowed to be touched at the clitoris, including touching oneself. So a DHS could be triggered when caught masturbating, for example.
Oh, wow.
Yeah. So yeah, they're just often a lot of women have sexual conflicts at a young age through, it could just be hearing the parents having sex or seeing pornography or getting caught or, there's so many potential triggers. So this is the other sensitivity pattern. So that's all that means. Gullet mucosa sensitivity pattern. So where we have an ulceration in the conflict active, same as the other one, but now there's pain. And then there's numbness through most of the repair phase, except for the epicrisis. Although there would be some discomfort in the repair phase too, because of the swelling and inflammation potentially. So conflict active phase. During conflict activity, the clitoral glans is overly sensitive to touch, hypersensitivity. And then in the healing phase, during the healing phase, the ulceration is replenished with new cells. The healing process manifests as clitoral hyposensitivity with decreased, or if the conflict was intense, a complete loss of sensitivity. The hypersensitivity is briefly reactivated during the epicrisis, so that acute part during the healing. With the completion of the biological special program, the clitoral sensitivity returns to normal. So yeah. So again, the main point of all of it, like a lot of it, is just really bringing that awareness, noticing when we're conflict active, and trying to downgrade and resolve that conflict more quickly and then move into the repair phase. And then we're not, whatever the symptoms are, we're just not fearing the symptoms, we're understanding them. They're all, laid out so we can have a lot more understanding.
It seems like the basis of German New Medicine is really just becoming all the more aware of your psyche, of your emotional body, of your mental body, and then we see what can present itself and manifest within the physical body if our emotional and mental are in conflict. And I really appreciate you diving into this wisdom and sharing this wisdom, sharing this knowledge. It's a little scary because it debunks Western medicine and kind of, it doesn't make fun of Western medicine, but yeah, it just reveals a lot of truth within a lot of people and it could, German New Medicine, it could also trigger quite a lot of people.
It could, if they're attached to that conventional system. Yeah, for sure.
Mm-hmm.
Yeah, but I mean, overall, it's really, once we learn it, and if we, like, I very quickly switched to this way. Of course, there's still all the old programming, but I just right away switched and everything's more harmonious. And it just, it's called the 5 biological laws of nature. And it just feels a lot more aligned with nature. And we're not, defective, and everything is not malfunctioning all the time. So with the understanding, it just makes everything a lot better. We're not fighting and fearing the symptoms anymore. We're completely understanding them, and we're just taking full responsibility for our health, basically. And they estimate that really 95% of the conventional medicine, like all the pharmaceuticals and all of the quote treatments and surgeries, getting body parts cut out. Most of that will just all be gone. It is still, conventional medicine is obviously amazing for the cuts and the breaks and their diagnostic, equipment and all these tools and things. If we just had this understanding, then it would be fantastic. So we could still keep that for what they're good at,
And that's
like
right. And Dr. Hamar he's not, like, his goal wasn't to get rid of conventional medicine, because like you're saying, he's wanting us to just find harmony between this theory and diagnostic testing and dealing with the scrapes and the breaks, and having surgery for those instances. So if people want to study with you, Daniel, there's a study group that you have. I will post a link in the show notes for people who want to reach out to Daniel and dive a little bit deeper into their own body and take responsibility for their body and their health, and try and resolve some conflicts and close some or get rid of certain programs that are creating even more conflict within the body.
Yeah. And and then moving forward too, and we can it just makes everything better in my experience. And we don't actually have to believe it on faith alone, even though he did go through university reviews and they never were able to find any fault with it. His science was fairly meticulous, but we just practice it in our own lives, and we can just see it. It's very apparent in our own lives right away, and the lives of people around us. If we see the symptoms they're experiencing and we look at what they experienced in their lives, what they perceive, it usually lines up. So, yeah.
And I'd love to continue the conversation and learn a little bit about intrautero conflict, what happens when we are in our mother's womb, and also what happens during the process of childbirth and the certain imprints that are placed upon us when we are born into the energy of fear versus being born into the energy of love and calm and peace. This is a conversation I would love to explore with you, Daniel, and we'll definitely get into that.
That would be great. We could talk about the recall healing, like I said, from Gilbert Fernand, and he's really great. He has this book, and it's just so interesting because it kind of opens up different avenues of inquiry, because to find the solution, because that's what we really want, is to find the cure for each of us. So his is called recall healing because it goes into the past a bit more. So really interesting. And if you ever wanted, we can always go through the female breast too, if you want to go into the breast stuff ever.
Absolutely. I saw that you had that open, and that is something we should explore, because a lot of women are being diagnosed with breast cancer.
And it's just crazy. It's crazy how it cascades, and it's just natural, and then they're getting things removed, and then just a bunch of other conflicts. And I've seen it already happen, and it's pretty tragic, to be honest.
Yes.
Unnecessary.
So much room to learn and grow, and I really appreciate your time today, Daniel. And
thank you. I appreciate all you're doing as well, and thanks for having me on. I really enjoyed it.
You're very welcome, and we'll talk to you soon. Have a good day, everyone. Thank you so much.
Thank you. See you soon.